The best ways to prepare for a tummy tuck. Well, you've made the decision, you're getting a freaking tummy tuck, and that is a big deal because it is such a powerful rejuvenation procedure for the female body after pregnancies. So I know you're scared, you're worried about how it's going to take care of you, how much pain it's going to be, but I assure you it's, at least in my hands, my patient will say it's better than they had feared. And then you have this anxiety of nesting and you want to get ready for the procedure, which you should. You know, it is a lot. I tell my patients it's a life event. You really want to make sure you are fully prepared to have this procedure. And some pro tips I will give you. So the first tip is you've got to have a good support system during your recovery. You need to have some help that first week. The first week, you know, it just sucks. You're going to be uncomfortable. You're going to walk in, hunch over a little bit. You're going to feel very tight. You're not going to be doing some of the things you normally can do. You won't be driving typically. Doing household work is going to be it's going to be uncomfortable, and if you try to do it, please don't do that. But you need to have a good support system, whether it be a husband or significant other or family members or friends, or going to a recovery house where patients, you know, come from out of town. They go to the recovery houses that help you in the recovery. But you need to have some help. You won't be able to do some of the things you are very comfortable doing almost on a daily basis. So these little things you need to prepare for. That is one of the biggest ones I can give you advice for. Get used to sleeping on your back. You will be in a kind of a reclined position for the recovery. So pillows under your legs, pillows on your back. A nice, soft, comfortable reclining position is the best way to get some sleep. If you don't get any sleep during recovery, you are just going to be miserable. Like, your days are going to suck. Your sleep schedule is going to be off, and it's going to make everything worse. So getting prepared for that is important. Taking a shower on a daily basis, that is going to be kind of almost an act of love for whoever's helping you. That first shower is very important. You need to make sure you're not dehydrated, your pain's controlled, and you've eaten something before you go take that shower. That way you have that feeling of getting lightheaded and you might fall. So having someone there with you during that first shower specifically is really gonna make a big difference, and it'll kind of get you more confident. I'm starting to get better. And then the last one I would say is prepare the house for to have a procedure, which means you need to get everything out that's dirty. Get it all out. If you have cats, they got to get out. Of all my bad infections, all my patients have had cats. I don't know what it is about cat dander, but there's something about cat dander. They're bacteria. I don't know what it is, but my bad infections from tummy tucks and breast surgery and contour surgery have all been associated with cats. So you know, you need to sleep separate from them. You need to change all your sheets. You need to get comforters, all that cat hair, get it off. You know, wipe everything down. Do a good deep clean of your home. If you have dogs, you know, just keep them away from you. That's another big aspect of just getting everything ready to decrease risk of infection. And I think the last one is be ready to have someone help with the family. If you have kids, and many of my patients are having tummy tucks, you still have kids that are young. You need to get ready for that. You need to have someone help you. You know, if you have a 2-year-old, they don't understand you've had surgery in the abdomen. They'll come up and jump on you, and they'll kick you in your abdomen. They don't know they're hurting you, and they cause bleeding, and then you have to have another surgery. So just be prepared for that. You need to have someone help with the kids. You know, they need to understand that you can't do some of the things, and you know, if you can just kind of put yourself out of the situation, it'll make your recovery a lot easier. And with that said, you're going to have a lot of guilt, and I can't help you with that. You're going to have this guilt of like, my kids need me, I can't do it, and then you find yourself crying like, why did I do this? But the reality of it is that, you know, if you have a good people, it's good support system at home, you will have less of that, and it will pass. It will pass, I promise. And then you'll be thankful that you did the procedure, because you'll get some of your confidence back that maybe you've lost, because you look and feel better. So those are some of my pro tips I would give you. Don't forget, give me a like and subscribe. I'd love to hear more questions you have. Drop me a comment in the comment section below, and I will catch you next time.